Gentlemen of the press, please give me a space to see our distinguished guests, please, and please. Gentlemen of the press, please, let's see our dignitaries, please. Your Excellency, sir, a performing governor, the Zamfara State Executive Governor of Zamfara State, Governor Dauda Lawal. Your Excellency, the Deputy Governor of Zamfara State, Your Excellency, the State Special Guest of Honor, the former Head of State of the Federal Republic of Nigeria and former President of the Federal Republic of Nigeria, Chief Olusegun Obasanjo GCFR, Right Honorable Speaker of the State House of Assembly, and honorable members of the State House of Assembly, the Secretary to the State Government, the Chief of Staff to His Excellency, the Head of Service, the Honorable Commissioners, Honorable Special Advisors, Permanent Secretaries, Heads of Extra-Ministerial Departments, both federal and states, medical practitioners here present, Your Royal Highnesses, the Emirs here present, my colleagues, gentlemen of the press, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuhu. It's Tuesday, today, 17 June 2025, Your Excellency. As you have hosted the State Special Guest of Honor, our father, our grandfather, and the father to the nation, the former President Chief Olusegun Obasanjo, who have come to the Zamfara State for the official commissioning of the newly remodeled Ahmad Sani Yariman Bakura Specialist Hospital. With your consent, Your Excellency, permit me to call on Kadi Hadi Sani Gusau to lead us in the opening prayers.
صلوا على النبي الكريم اللهم صل على سيدنا محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد اللهم بارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم في العالمين إنك حميد المجيد يا أرحم الراحمين يا أرحم الراحمين يا أرحم الراحمين يا رب العالمين ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت الغفور الرحيم اللهم إنا نسألك من الخير كله آجله وآجله ما علمنا منه وما لم نعلم ونعوذ بك من الشر كله آجله وآجله ما علمنا منه وما لم نعلم اللهم إنا نسألك العفو والعافية والمعافاة الدائمة في الدين والدنيا والآخرة اللهم إنا نسألك رضاك ورضا نبيك ورضا الوالدين يا الله منا روقنك الله كسامو wannan haduwa ta mu albarka Allah ka sa ai wannan taro lafiya a kare lafiya ayyukan alkhairi da mai girma gwamnati yake yi a cikin wannan jaha Allah ya saka mashi da alkhairi waɗanda ake kan gudanarwa Allah shi ba da ikon kammalawa cikin sauki Allah ka cika ma mai girma gwamnati sauran kudurorin shi na alkhairi ubangiji Allah muna roƙonka Allah ka ba mai girma gwamnati kariya a cikin gidan shi da wurin aikin shi da a cikin tafiye-tafiyen shi Allah ka kare shi ga sharrin makiya da mahassada da mashi masu zagon ƙasa sauran jagororin da suke tare da mai girma gwamnati suna taimaka mashi Allah ka saka musu da alheri Allah ka karfafe su uwayenmu masu girma sarakuna da suke wannan wuri Allah ka saka musu da alheri Allah ka ƙara musu lafiya Allah ka ja kwanansu manyan bakin da aka gayyato daga ciki da wajen wannan jiha sun ka zo wannan wuri lafiya Allah ka mai da su lafiya Allahumma ahsin aqibatana fil umuri kulliha wa ajirna min khizyi dunya wa azabil akhirah ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين
Amin, Ya Rabbal Alameen. Permit me, Your Excellency, to invite the Honorable Commissioners of First State Ministry of Health, Dr. Nafisa Muhammad Maradun, to deliver a welcome address briefly.
Our dear respected leader and commander of rescue mission, the executive governor of Zamfara State, Dr. Dauda Lawal. Our special guest of honor, former president of the Federal Republic of Nigeria, highly respected global icon, Chief Olusegun Obasanjo, GCFR, the Deputy Governor, Zamfara State, Speaker, Zamfara State House of Assembly, Secretary to the State Government, and other members of State Executive Council, other distinguished personalities present, the President, Nigerian Medical Association, our party officials, distinguished ladies and gentlemen, Assalamu alaikum wa rahmatullah. The health sector once again is recording a tremendous achievement today with the commissioning of this tertiary hospital, the Ahmad Sani Yariman Bakura Specialist Hospital, that has just been reconstructed and upgraded in its best form and standard. Your Excellency, the construction work of this hospital started in the year 2007. The commissioning for full operation took place in the year 2012. And since then, this hospital continued to operate as the only state-owned tertiary hospital. However, with the coming of this administration, some modifications were identified that need to be made on this hospital to enable it stand the test of time as part of the rescue mission of His Excellency to transform the health sector. Similar renovation exercises have already been accomplished in other hospitals across the state. Distinguished guests, ladies and gentlemen, as I stand before you, I see a state-of-art model of a tertiary hospital. For the first time in the history of Zamfara State, we are having a CT and MRI machine in the state. This reflects His Excellency's commitment to ensuring that we are not left behind in the digital age, and it is the aspiration of His Excellency, the Executive Governor of Zamfara State, to see that all residents of the state have access to quality healthcare services they require to live a healthy and a productive life. I want to use this opportunity and extend my heartfelt gratitude to His Excellency for investing in the health sector. And on behalf of Ministry of Health, I congratulate His Excellency and the good people of Zamfara State for this great achievement. May this be a source of knowledge, empowerment, and progress for the generation to come. I also call on stakeholders and members of the community to continue to support this hospital. Our collective involvement is key to ensuring that this investment yields long-term benefit. Distinguished guests, I welcome you all to this momentous occasion. I wish us a happy stay and safe journey back to our various destinations. Thank you.
Thank you very much, the State Commissioner for Health, Dr. Nafisat Muhammad Maradun. Distinguished personalities, a round of applause for this Iron Lady. While Dr. Nafisat was busy delivering her welcome address, let me recognize the arrival of the former governor of the state, Mahmoud Aliu Kafi Dallatun Zamfara. Your Excellency, the Executive Governor, our distinguished personality, it could be recalled that this hospital was built by the former governor Mahmuda Aliyu Shinkafi and remodeled by the present governor, Dr. Dauda Lawal. Together with him for recognition is Ambassador Shehu Cheka Bunu, a former ambassador to the Kingdom of Saudi Arabia. Your Excellencies, you are highly welcome. Next, on the agenda, we don't have any entertainment going by the fact that this is hospital and we have patients. We don't want them to be disturbed. As a result of that, may I now humbly invite the former #1 citizen of Nigeria, former President of the Federal Republic of Nigeria, Chief. Okay. Briefly, may I now invite the contractor that remodeled this hospital, Mustafa Hussein Falaki, for just 3 to 4 minutes to say his words regarding the contractors and how he handled the construction of Yariman Bakura Specialist Hospital. Dr.
Your Excellency is the Executive Governor of Zamfara State, Dr. Dauda Alon, Your Excellency, the special guest and former President Chief Olusegun Obasanjo, GCFR, all protocol duly observed. Distinguished ladies and gentlemen, Assalamu alaikum. Let me begin by expressing my profound gratitude to Allah subhanahu wa ta'ala for allowing us to witness this important event. I would also like to extend my deepest appreciation to His Excellency, the Governor of Zamfara State, for his trusting Minjere Health Services to undertake this important project of transforming the Yariman Bakura Special Hospital to a world-class hospital. Special appreciation to our special guest of honor for gracing this occasion and witnessing the transformation in our dear state. I equally appreciate the support of the members of the Council of the State for support and other state and the Ministry of Health management staff of this hospital for their cooperation throughout this project. To our clients, to our architects, engineers, and the team, we worked tirelessly in the last 1 year. This project stands as our collective legacy. This project is a turnkey project that comprises 3 components: the reconstruction and remodeling, equipping the hospital with modern equipment, and deployment of hospital information management system. Ladies and gentlemen, the future of healthcare in Zamfara State is being written today. Let us continue to support this administration to do more in improving the life of every citizen of Zamfara State. Once again, we appreciate the confidence given to us to execute this project. Long live Zamfara State, long live Federal Republic of Nigeria. Thank you.
Thank you very much. Your Excellency, the State Governor, permit me to invite your special guest of honor, the former President of the Federal Republic of Nigeria, Chief Olusegun Obasanjo, to deliver his address. Chief Olusegun Obasanjo, GCFR.
Your Excellency, the Governor, please. The Governor of Zamfara State, the Deputy Governor, my former colleague, the former Governor, Your Royal Highnesses, distinguished members of State Assembly, members of the State Council, Executive Council, distinguished ladies and gentlemen. Governor, last night, when you gave me the opportunity to make a short remark at the sumptuous dinner that you had in my honor last night, I thank you for bringing me back to Zamfara State to see the new, improved, and improving Zamfara State under your leadership. And I said that for human development, first of course you need security, and you are handling that. Second, you need food security and nutrition security, and we talk about that. Third, you need health care delivery. And here we are. And two things here this morning that surprised me. The Commissioner for Health said you have CT scan and MRI. I know teaching hospitals in Nigeria that have no CT scan and MRI. Some have, they are not working. Here you are. You have it, it's working, and it's giving service. Second thing, I saw on the program, the contractor will make short remark, and I was waiting for the contractor. Then, when the contractor was making his remark, I thought you, I said, is that the contractor? And you say yes. I was pleasantly surprised because I was looking for not somebody as black as the contractor is. I was looking for somebody not as black as the contractor is. So again, we have the capacity, but we have to give the opportunity for the capacity to manifest itself and to develop. Again, that is what you are doing. I am very happy last night you told me about the nursing schools, and I said, look, for hospitals, especially when many Nigerians who have been trained as medical personnel are jappering, which is going out of the country looking for better conditions. I say, how do you hold them here? And you have to give them a bit of incentive. You have to. We need all the personnel that we can have, because a hospital to deliver, you need the right environment, and that is the refurbishing, renovation, but you need the equipment, and then you need the personnel. I'm happy that you have brought all together. And let us make good use of this. The point that I made last night, with a population of over 6 million people, you are bigger in population than about 12 countries in Africa. In land area, you are bigger than more than 12 countries in Nigeria. So you have all that you need to make this state an exemplary for other states in Nigeria. And you are given the leadership. Please go on regardless, relentless. And as I said to you, even though I am gradually going to the departure lounge, but I won't take my boarding pass until you and I get this state to become one of the leading states in Nigeria. And you have asked me to come. I have come. I have seen. But I'm going nowhere yet. And as I said to you yesterday, then if you don't invite me regularly, I will invite myself regularly. Because there's a lot that we have to do together. We've talked about education this morning and yesterday. Health is here. We've even talked about industry. We've talked about solid mineral. There's a lot we can do in all these areas, and we will do. I have great pleasure to be here and to commission this refurbished and re-equipped hospital for the well-being and welfare of everybody that will come to this hospital. Thank you very much.
A round of applause for the former president. An elder statement, Chief Olusegun Obasanjo, the Yalla Bay of Sokoto. Your Excellency, we thank you very much for having your time and come to Zamfara and see things for yourself. Before inviting the executive governor to deliver his address at this very momentous occasion, let me quickly announce for recognition a chieftain of APC in the state, a former national secretary of Abuga, and a former gubernatorial candidate of Abuga in the state, Dr. Sani Abdullahi Wambai Shankafi. Sir, you are highly welcome.
Distinguished ladies and gentlemen, now my great honor and pleasure to invite to the podium our executive governor, the performing governor, His Excellency Dawda Lawal, to deliver his address. Your Excellency, sir.
A'udhu billahi minash shaitan rajim. Bismillahir Rahmanir Rahim. The Deputy Governor, Zamfara State, Malam Mani, Malam Mummuni, our respected invited guest in person of the former President of the Federal Republic of Nigeria, General Olusegun Obasanjo, GCFR. Let me also recognize my brother, the former governor of Zamfara State, who happens to be the one that built this hospital that we renovated and refurbished today, Mahmouda Aliyu Shinkafi. The Speaker, Zamfara State House of Assembly, and all the members of the State of Assembly, the Secretary to the Government, Chief of Staff, Head of Service, our party chairman represented by the Secretary, and all other party members, honorable commissioners and advisors that are here with us, our royal fathers, and all the security chiefs, and some of our special guests that are here with us today, the Chief Medical Director, Nigerian Medical Association, that is also here with us, our royal fathers, distinguished ladies and gentlemen, Assalamu alaikum. I'm here with a happy heart today on this remarkable day, and I'm grateful to Allah for His infinite mercies that we can see this day for commissioning the transformed Ahmad Sani Yariman Bakura Specialist Hospital. This event is a definitive statement of intent, a symbol of rebirth, and practical manifestation of our vision to ensure accessible, affordable, modern, and dignified healthcare for every citizen of Zamfara State. We invited our distinguished August visitor, our father, elder statesman, and former President of the Federal Republic of Nigeria, Chief Olusegun Obasanjo, GCFR, to commission this essential project. Your Excellency, on behalf of all the citizens of Zamfara State, we thank you for honoring our invitation and welcome you to your second home, Zamfara State. A state that is dear to your heart because our primary vocation here is agriculture, something you're very passionate about. Your Excellency may be interested to know that when we assumed office, we were confronted with the ugly reality of a deteriorated health sector marked by decayed infrastructure, obsolete equipment, and declining morale among healthcare professionals. The Amasani Yariman Bakura Specialist Hospital, which should have stood as the state-owned tertiary healthcare delivery facility in Zamfara and become a shadow of its intended purpose. The most basic procedure could not be carried out in this hospital. Critical diagnostic equipment were unavailable, and patients needing urgent specialist care were regularly referred to outside of this state at significant emotional and financial cost. It was an unacceptable condition that weakened public confidence and jeopardized life. Your Excellency, health is one of the pillars of our rescue mission. When we came in as government, we immediately conducted a 360-degree need assessment of the healthcare system in Zamfara State. The result, Your Excellency, was, to say the least, very shocking and disturbing. For example, in a state with a population of about 6 million people, over 600 primary healthcare centers, 18 general hospitals, and 1 tertiary hospital, there was no one functional ultrasound machine. And even then, there was, or the one that was available was actually sellotape. And the situation was really bad. This critical situation prompted our declaration of state of emergency in the health sector on the 30th of January 2024. Our response was a deliberate, comprehensive, and policy-driven reform. It resulted from strategic planning and broad consultation with health professionals and development partners while ensuring alignment with our broader development goals. The Amasani Yariman Bakura Specialist Hospital has undergone both expansion as well as renewal. New facilities have been constructed. Doctors now have newly completed residential quarters, including 2- and 3-bedroom semi-detached units and a befitting residence for the chief medical director. A serene and quiet patient relaxation arena has also been introduced alongside the redesign and beautification of the hospital landscape. We also laid down internal road networks that support mobility, orderliness, and aesthetics. The new centers constructed are new obstetric and gynecology O&G, new radiology complex, new laboratory complex, patient relaxation arena. Equally important is the extensive renovation and modernization of 14 key departments, all of which have been revitalized and upgraded to contemporary standards. We have matched this infrastructure improvement with a robust supply of cutting-edge medical equipment across all critical departments. This includes advanced diagnostic and therapeutic tools for radiology, dialysis, surgery, ophthalmology, ENT, physiotherapy, endoscopy, echoradiography, dentistry, and general clinical care. The hospital also has been furnished with new hospital beds, electronic system, general furniture, and waste management infrastructure to ensure an environment that meets global hygiene standards, safety, as well as comfort. In terms of imaging facilities, we have also upgraded, reconstructed, and fully equipped that department with modern state-of-the-art medical facilities, including installing a brand new MRI, as well as a CT scan for the first time in the history of this state. Our patient will no longer travel out of Zamfara state to seek for medical attention. Everything is provided here going forward, and will continue to do that, inshallah. Your Excellency, this is a revolutionary intervention in the healthcare sector of Zamfara state. This is the first time we have a CT scan or MRI machine in the history of our dear state. To support operational excellence, we have deployed a complete hospital information management system that integrates all departments and services, including patient registration through interconnected modules. This system marks the beginning of digital health governance in Zamfara. It will reduce delays, eliminate bottlenecks, and significantly enhance transparency, data management, as well as patient outcomes. Per our commitment to accountability, the project passed through a comprehensive and competitive bidding process that upheld the state public procurement law. The eventual contractor, Minjira Health Services Limited, was selected based on its technical expertise, cost effectiveness, as well as a very good track record. I commend the Minister of Health and those involved for their diligence from conception to completion. With this current status, this hospital is equipped to function as a true referral center for complex medical cases, a credible training facility for health personnel, and a hub for medical research and innovation. It is ready to serve Zamfara and offer specialized services across the Northwest and beyond. However, the sustainability of this vision depends on effective maintenance, strict adherence to ethics and standards, and continuous training, and will continue to train and retrain you. I urge the hospital management, health workers, and support staff to treat this institution as a sacred trust and to serve our people with kindness, compassion, honesty, and excellence. This is not just an investment in building our machines. Instead, it is an investment in people's health, dignity, and future of our people. This administration is determined to build a resilient, responsive, affordable, and equitable healthcare system that works for every citizen, from our urban centers to the most remote villages in Zamfara state. This commissioning is in continuation of our effort in the health sector. Renovation and re-equipping of 7 general hospitals across the 3 senatorial zones have been completed and commissioned. We are investing in rural health infrastructure through revitalizing primary healthcare centers and have prioritized expanding healthcare access through the contributory healthcare insurance scheme. Our collaboration with development partners remains strong, especially in immunization, maternal and child's health, nutrition, and wash services. And let me also say this, I'm happy to announce that the UNICEF have certified Zamfara State from September 2024 to date as polio-free. However, we recognize that infrastructure alone does not save lives. That is why, alongside the physical transformation of this hospital, I'm proud to announce a series of bold and strategic reforms in our deliberate bid to improve our human resource for health. Effective immediately, Zamfara State, under my leadership, has adopted and approved the full implementation of the revised consolidated medical salary structure CONMES as obtained in the Federal Civil Service. And this includes implementation of skipping relevant allowances and related benefit in line with federal government standards. The introduction of a new rural posting allowance designed to encourage and reward medical personnel who accepted posting in hard-to-reach and underserved communities, and the opening of the career progression bar for medical doctors allow them to reach CONMES 7, which is equivalent to grade level 17 is obtained in the federal system. With these measures, Zamfara State offers the highest salary package for medical doctors in northern Nigeria. This is a deliberate and visionary step aimed at reversing the tide of professional brain drain, retaining our best talents, and positioning Zamfara as a hope for excellence in healthcare service delivery. In the same regard, I've approved the recruitment of additional medical doctors, which will commence immediately. This is part of our broader effort to strengthen the health workforce and ensure that the upgraded facilities are fully staffed to deliver world-class medical care to our people. Let me call upon the Bureau of Zamfara to take ownership of this hospital. A lot of money has been spent, and therefore we must make conscious effort to maintain this hospital and guard it jealously. Report negligence, promote its proper use. This hospital has been built with your mandate and is meant to serve your needs for generations yet unborn. Do not allow apathy, vandalism, or ignorance to reverse the progress we have made so far. On this note, I indeed appreciate our distinguished guest, former President Chief Olusegun Obasanjo, GCFR, for the honor done to us by accepting our invitation to this critical occasion of commissioning this refurbished specialist hospital, that is the Ahmed Sani Yarima Bakura Specialist Hospital, Gusau, a fully remodeled, comprehensively equipped facility. May it be a pillar of hope, healing, dignity for all our people. I want to thank you, and may God bless Zamfara State and the Federal Republic of Nigeria. Your Excellency, I seek your permission to speak in Hausa for our local audience briefly. Al'umma assalamu alaikum. Yau da hikimar Ubangiji da yadda shi kamar yadda muka zo maka alkawari
Channels Television now takes you to Guzau, where the Ahmad Sani Yarima Bakura Specialist Hospital is being commissioned by former President Olusegun Obasanjo in company of His Excellency, the Governor of State. So part of the things that you are seeing in this hospital that has just been commissioned, the this hospital has a radiology department, has a CT scan, and a number of other facilities that you are seeing right now. And you have seen an NHIS clinic and a number of other facilities in the hospital right this moment. And as you can see, it's the second day of the Zamfara Governor's project commissioning, and we have also been told that there will be a movement to a road project commissioning at GRA. The itinerary is that of it includes the flag off of a road construction project in the GRA area of the state. The screen right now also has a general outpatient facility, as you can see, and it's already active, as is obvious to you right now. In no time from now, we'll be taking you to the flag off of the road commissioning again with the president, the former president Olusegun Obasanjo.
Can develop. And what are the infrastructure we are talking about? Infrastructure for transportation, infrastructure for communication, infrastructure for energy, infrastructure for water and sanitation. Here, what I have seen coming, which is done only within 2 years as infrastructure within the urban center and leading to the rural area, is commendable. Governor is leading, as the commissioner said, by example. He's exerting himself. Then
You're still on to Channels Television, your home for the news. And you've been on to our continued coverage of the second day of projects commissioning by the Zamfara state government. Earlier on, you were on to the same broadcast, this time featuring commissioning of a hospital project that had in attendance former President Olusegun Obasanjo. And this is the concluding part of day 2 now of the project's commissioning by the current Zamfara government, this time featuring the inauguration of a newly built network of roads. And from here, we'll be moving on to another live broadcast. This time, we'll head over to